In a democracy, the public ultimately makes decisions about what happens and doesn't happen. So the public can decide, okay, we're not going to do animal research. That could happen. I feel like if the public is making those decisions, they should have the best information they can to inform them. And when I looked around at that time and look around now, I see so many campaigns and so many groups that are contributing to public perceptions on the issue, but not always representing the full range of how the work's done, why it's done, what would happen if we didn't do it, and the kinds of moral dilemmas that we wrestle with. So I think it's important to reach out to the public, provide information, and then welcome people to share with us the moral responsibility to decide what to do and how. So I think that's really key. It's only going to become more key. We're up against a lot of forces that I think want to drive towards a particular agenda, ending animal research, for example, without really telling the public what that would mean. And I think scientists are good people to share back with the public because they have that information and they can best project what would happen if we don't do the work and what kinds of consequences there would be ultimately. I think the public is concerned with medical and scientific progress. So learning new things that help us better manage our lives, better manage the environment, better manage things for the animals themselves. So I think they have all of those interests. Children and child health tends to be a particular interest, but so is non-human animal health. And we can see that in the US in terms of how people treat pets, right? So there's a lot of concern there. The public has an interest in the animals being treated well. They have an interest in the progress. And I think the best way to reach out is not necessarily to focus on a specific issue or a specific population that benefits, but to show the full range and say, these are all the different reasons. You cannot easily disentangle these things. So one of the two examples that I'll talk about a lot with the public is the discovery of serotonin, okay? So serotonin is a brain chemical. It's one that most people know about. It's involved in a lot of mental health issues. It's a target for a lot of drug treatments for kids, adults, and for other animals. How was it discovered? Well, over a 45-year time period, beginning in like the 1930s, there was a scientist working on how blood coagulation worked. He was interested in vasoconstriction. Over 45 years, basically, serotonin was discovered, synthesized. People figured out it was in brain. People in the 1960s said, wow, it's involved in mental health. So it's involved in psychosis, which meant then you had an understanding that let you develop drugs. But it let you do so many different things, and it wasn't predictable at the outset, right? At all. So that guy, he wasn't thinking, I'm going to come up with a cure for depression. I don't think. I don't know for sure. But he was interested in how vasoconstriction works. That's how science works. So saying that everything's a one-for-one or we're doing a project just to fix this one thing, I think conveys a false impression of how science works. And I think that in itself contributes to huge problems in misunderstanding and then in decision-making. The other example I use now a lot is Ebola. So let's think about Ebola. Let's think about what it's doing in Africa to human populations. Let's also think about what it's doing to wild apes. So in 2006, thousands of gorillas died. They're highly, highly endangered from Ebola. So we have human populations, we have ape populations. We want a vaccine for Ebola for a lot of reasons, right? How do we get there? Well, some of how we're getting there is based in biomedical research conducted in the US by multidisciplinary teams using captive populations of chimpanzees and of monkeys. So you now have a moral dilemma. Do you want the vaccine? And what happens if you don't get it? And whose interests are being protected if you don't do the work? And you can see really easily it's very complicated, right? What's the answer is something the public has to decide. That one also gets you into the global views. So science doesn't have borders, right? And the idea of who decides. So those are the kinds of approaches I take. Not so much let's focus on one disease or one population or one country, but let's talk more generally.